Hi, I'm Dr. Story. I'm going to show you how exactly I analyze the wrist to determine where and how to do adjustments to that wrist. Firstly, it's the history. If a patient tells me I have a difficult time doing push-ups, doing other types of exercises, these are things that I look for in the history, what they tell me. So there are 15 bones between here and here. Can you believe that? There are 8 carpals, 5 metacarpals, and the radius and the ulna. Now the thing is that you're going to be doing different adjustments to different areas depending on where the person has the joint problem. Now typically, if a patient says something like it's hard to push things, or I'm having a difficult time doing push-ups, that type of thing, very often that is that clues me into that I'm going to adjust them in the middle carpal joints. When I test them to determine where I'm going to do that, I'll often have them bring their wrist backwards. Now a normal, what I would consider normal backwards, is anywhere between 80 to 90 degrees, like this. Now what I'll do is, if that hurts the patient, I'm not going to stop there. I'm going to further analyze that area. And what I'm going to do is I'm going to take my finger and I'm going to push on this metacarpal. Now what happens is, if a patient says, oh boy, that hurts, I'm going to adjust between the trapezoid and the scaphoid. That's where the problem lies. If I push the middle one, I'm going to be adjusting between the capitate and the hamate. Very often you'll see patients that'll have like a ganglion cyst over that area. If I push between the 4th and the 5th metacarpals and it hurts when they extend, very often they'll have a problem with the hamate and the meniscus, where the ulna comes together. So very often I'll be adjusting that if they have pain in that area. Wrist adjustments are extremely beneficial, not just for carpal tunnel syndrome, but for many conditions. Many people have pain in the wrist. They assume it's carpal tunnel syndrome because that's the only diagnosis they know, but they don't have any numbness or any tingling in the hands or any muscle wasting. They just have joint problems. Again, between right here in my fingers, there are 15 bones. That's a lot of joints that can go wrong. And so very often, because we're using our hands in our daily life, we can get misalignments of these joints. We can get joint problems where the joints don't glide together, and an adjustment to the wrist can literally save a person's career. So if you like this video, give me a thumbs up, subscribe to my channel, and if you have any questions regarding wrist problems, put them in the comment section below and I'd be happy to answer them for you.